Welcome and thank you for joining us for this episode in the Fearless Minds research series, Care and Control, Preserving Dignity at End of Life. I'm Patrick Major from Flinders University's Fearless Minds team, and it's my pleasure to welcome you to today's discussion as we explore dignity at the end of life and the priorities of care for people who are dying. To begin with, I'd like to acknowledge that we're hosting this discussion on the traditional lands of the Kaurna people, and that we pay our respects to their elders past, present and emerging. We also acknowledge and convey our deep appreciation to the elders of all the nations upon which Flinders operates. This event is delivered as part of our Fearless Minds series. Throughout this series, you'll meet some of Flinders University's most engaging early to mid-career researchers as they bring you their latest research from a diverse range of fields. Today, we're very fortunate to be hearing from Dr. Deidre Morgan, who is a senior lecturer in palliative care here at Flinders University. Deidre is a researcher from the Flinders Research Centre for Palliative Care, Death and Dying, otherwise known as REPAD. She has 25 plus years experience as an occupational therapist, and her clinical and research focus is in palliative care and how we can improve people's function at end of life. Deidre, thank you very much for joining us today.
Thanks, Patrick.
So Deidre, I thought we'd just start by talking about something we're all very familiar with. Obviously, death is something we're all going to be touched by at some point in our lives. From your experience, what's it like working with people who are dying and their families and carers? And over your career, do you have any particularly profound experiences you can share with us?
It's a great privilege to work with people at this point in their life. I think one of the things that has really stood out for me is that the little things in life actually take on more importance and greater significance for people as they approach the end of life, and things that we would perhaps take for granted, like being able to clean your teeth or being able to stand up from a chair and walk to the toilet, become incredibly important. But we miss them often because they're such routine activities.
And so a research paper you had published in 2021 in the Palliative Care Medicine Journal explored people's experiences with dignity in their personal hygiene, which is maybe not something that people think about all the time, but these were people with advanced disease who needed to be cared for in terms of their showering and their toileting and dressing and so on. What did this research tell you about people's experiences?
So what we found was that dignity is important for everybody at the end of life, and particularly with what we called intimate hygiene, so showering and toileting. Some people had experiences where their dignity was conserved, and other people had experiences where it was compromised. And a big part of that came down to how the care was actually provided by the carers, both physical and verbal. And that there, I guess in effect, there was almost a two-way relationship that happened in that process, where the people being cared for actually tried to put carers at ease in order to get the care that they needed. But there were specific ways and specific things that carers could do to help conserve somebody's dignity at this point in time.
So Deidre, why do you think our bodies are so important to us emotionally and psychologically? I mean, I imagine for people who become very used to their bodies and the way that they function, how do you think they deal with that experience? And do you think it's confronting for people to see their body become increasingly unfamiliar to them and losing that function?
As you become older, or even when you're younger, if you have advanced cancer, your body starts to change as the disease affects it. And I think we all live in our bodies out into the world, and often that's an unconscious thing, but we do everything through our bodies. And when you have advanced disease and your body starts to change and you can see lumps growing, or you're having shortness of breath, or you experience pain, for people with advanced disease, that's often a reminder that their life is being cut short. So it's very, very confronting.
So in this 2021 study we mentioned, your team spoke to Jane, a 65-year-old woman with cancer of the lymphatic system. And she said, "I'm an incredibly strong person. I've advocated for disability, for women in employment. I can stand before judges and argue cases, and yet when it comes to my toileting needs and bathing needs, it's still a giant issue for me. How do you feel about this quote? Obviously, it's an incredibly strong one. I mean, I certainly feel like it sums up people's vulnerability and discomfort with intimate hygiene in the palliative care setting. What can carers do to minimise the discomfort that comes with this and empower their clients?
I think one of the things we need to take from this quote is that we can't make assumptions that everybody's going to be comfortable about talking about their care needs, irrespective of educational level, irrespective of anything else that we know about them, that for some it's really, really difficult to ask. And I think it's easy to forget that when there is a relationship of being a patient or a client and somebody else is providing care, or even a family member providing that care, there's a huge vulnerability. And I think we need to, as people providing care, take the initiative to say to people, what is it that you need from me? How do you want me to help? What kind of help do you want? When do you want me to start? When do you want me to stop? And we need to keep creating those opportunities to have those conversations with people, and also allow people to time to process that. So if they can't give you an answer straight away, don't just assume that they can't articulate their needs. We, as carers, we have a responsibility to create those opportunities to draw out what people need.
And while we're on that topic of carers, obviously they are people too.
Yeah.
Many of them are unpaid carers. We know there's an army of unpaid carers in Australia who provide thousands of hours of unpaid care to loved ones. And others are professionals in the workforce. What challenges do you think they face when they're caring for people at end of life?
I think providing care with intimate hygiene changes the dynamics in a relationship. And I think we can make the assumption that because they are mother-child, a husband-wife or partner, that it's okay to both receive care and also provide care with wiping somebody's bottom in the toilet. And it's actually not okay for a number of people. And we need to, again, as carers and in the health system, be cognizant of that and be mindful that just because it's an informal carer doesn't mean that they're going to be comfortable to provide that care. I remember working with one woman who could not, the daughter of a woman who could not take her to the toilet. And she said, because I worked in a nursing home when I was a young child and I had to empty everybody's bedpans in the nursing home. So she just couldn't go there. So again, it's that creating opportunities and asking people what they're capable or able to do.
Not assuming their consent.
Yeah. And continuously creating those opportunities. It's not a one-off thing.
Do you think as a society we're getting better at talking about death and dying and palliative care, or is there still an enormous stigma attached to it?
I think there is still a stigma attached to it often. I know when people come into palliative care, they usually often say, why didn't I come here earlier? I don't know why I didn't come. But I think there is a fear about it, and it's confronting to be mortal. And we kind of live our lives as if we're not. So I think there is a stigma, and I think that there is, having worked in it, it's incredibly supportive care and incredibly focused on what the patient needs and what the family and the carers need as well, often more so than what happens in the rest of the health system. Does that answer your question?
I think it does. And do you think we can do more to look after people who work in palliative care? Do you think the carers need to be supported better?
Absolutely. And I think one of the things when I talk to health professionals and carers about this paper and the research findings is that this is not a criticism of them, that health professionals, and especially in COVID time, but even before COVID times, are usually run off their feet and really, really busy, and you can get into habits and patterns of relating to people where you don't always give people the opportunities to talk about what their care needs are. So and because my research is looking at what are those small micro things that we can all do that will still make a really big difference, but don't take a lot of time, don't cost a lot of money. And I think this is some of the findings that we found about creating those opportunities for discussion are doable and can support health professionals in this space.
Because preserving that dignity at end of life obviously is so much harder if the professionals themselves aren't being supported properly.
Yeah, and you know, we all come as carers and as patients. Everybody comes with their own needs and their own past history, their own current history, their own family pressures, and a bit of compassion for both the carer and the recipient of the care.
So Deidre, obviously you come from an occupational therapy background. Can you tell me a bit about what drew you to palliative care in the first place and why, I think you've already described this quite a bit, but why in particular it's so important to you?
Yeah. It got into palliative care by accident, not by accident, but I took a referral and they built a new palliative care unit at our hospital. So I fell into it that way and loved it because it was the care that we were providing wasn't just rhetoric about caring for the whole person. It was actually looking after physical and emotional and spiritual needs, and it wasn't rhetoric. It was the real deal, and that was why I went into health, was to be able to work with and support people. What makes occupational therapy and palliative care really important is that we work with people to facilitate control and empowerment about doing what's important to them at the end of life. And we know how important that is because people are choosing to end their life because they can't do things that are important when we look at the data from Canada. So doing small things is of vital importance, whether it's being able to take a shower yourself or take your daughter to school or be able to stand up from a chair and walk a short distance. These things become incredibly important, and occupational therapy and palliative care gives you that opportunity to support people and empower them, I think, to take control over the time that they've got left.
And Deidre, what led you down the research path into this area?
I was tapped on the shoulder to go into research and have stayed there. And I think one of the things I'd like to do with my research is to be able to support health professionals in the clinical practice, especially occupational therapists, but also allied health, and create and help them to provide care that is informed by evidence and guided by evidence, and also to improve the care of patients. So it's that dual focus of supporting clinicians and supporting patients and carers.
So would you have any advice to anyone interested in pursuing a similar research path to yours?
Yeah. I would say don't say no. Give it a go, and you'll be surprised at what opportunities unfold. It's really helpful to have a mentor and find somebody that you can talk to who will support you through that process, but give it a go. If you're a clinician, give it a go, and you might find that you move into more research. Collaborate. If you don't end up going into research, collaborate with researchers who want to support your work.
What a fantastic discussion we've had here today. Thank you, Dr. Deidre Morgan, for sharing your time and thoughts with us today. Remember, you can watch any of our Fearless Minds episodes on the Flinders YouTube channel. We hope you can join us again for the next one. Thank you, and bye for now.